So I read an article called The Future of Public Health by Thomas Frieden, and to summarize it, it basically starts with talking about the lifespan and how it's increased by 30 years, and 25 of those 30 years has actually come from improvements in public health and the availability of just healthcare in general. So the lifespan has increased so greatly because there's been a reduction in child mortality rates, and that's due to availability of immunizations, sanitation, clean water, just basically anything that can help improve the health of a child, whether it be any of those things I've mentioned before. So when it comes to public health, it focuses mainly on one thing, which is who can benefit the most or who can just benefit in general. So to make sure that everyone can benefit somehow, there needs to be things that have to be considered, such as economic, society, and environmental, and some other factors as well. Also, this article talks about building a public health pyramid. There are 5 levels to building this pyramid, and starting at the bottom going to the top, it talks about socioeconomic economic factors, changing the context to make individuals' default decisions help, long-lasting protective interventions, clinical interventions, and counseling education. So basically, giving the patient what they actually need in order to keep a healthy lifestyle. So all 5 of these factors make up the pyramid and help build public health and improve it as well. It also talks about infectious disease and how it's spread throughout the United States and the world, as well as chronic illnesses in the United States and in the world as well. It also talks about the role of the government, and it said that the role of the government is 3 things. The 3 things are to promote free and open information, protect people from harm caused by others, and to implement societal interventions which individuals cannot effectively or efficiently protect their own health. So basically the government is kind of initiating everything and making sure that the patient can get whatever they need in order to understand what's going on. The main part I really want to focus on is the future of public health. So, and the impacts that come along with it. One of the big things that I found was that clinical medicine and public health in general would see increases in cost. But the upside of that is that with increase in costs, there'll be an improvement in the outcomes. So better treatments, better availability, and stuff like that. There's going to hopefully be new delivery methods and technology, and because of this, life expectancy could continue to grow, which means that we could all outlive what it's projected to begin with. With everything that is going to be advancing, public health may not be able to keep up with it, which could possibly lead to harder or more difficult healthy living. Because it could be hard to promote healthy living, there could be an increase of use of tobacco and alcohol, but at the same time, if it can keep up, then we would be able to have a semi-healthy lifestyle and not see as much use of tobacco and alcohol. So with everyone working together, public health can ensure that the people can live a healthy lifestyle and more prosperous lifestyle and outlive the life expectancy that's in place. So basically, there's more going to be hopefully better better public health, but there's always going to be a downfall when it comes to health care. So hopefully there will be improvements that will benefit us greatly.